services continued to need to be access safe and stable care for their children. So we did and have been trying to make sure that we are messaging out to stakeholders across the spectrum of providers, to families, to legislators, that if families need to work and they need to continue to work, that waiver process is available. Shortly after counties began to close, the Department of Education made the decision to temporarily close the K-12 schools and advised closure of face-to-face activities at the institutions of higher education. And so very quickly we began to enter into conversations around what's typically known as the part-day school age program, which is part of our definition in our Child Care Human Services Code, our Human Services Code 3273A, that indicates that part-day school age programs that are operating in excess or under 90 days could continue to operate. So we had a lot of interest very early on in March from community-based organizations inquiring whether services that they might typically have offered in the summer might be able to begin early, or a modified version of those services begin early to support school-age children that weren't in their K-12 setting because of the closure notice. And again, our feelings about this were really trying to be supportive of families that needed to continue to work. And so we did a lot of conversation and began messaging that those part-day school-age programs could operate. So as we've gone to statewide stay-at-home, we moved into a process where those part-day school-age programs also needed to apply for a waiver. If any of you are part of that cohort that stepped up to serve children and families by reopening during that time, just want to give you a little bit of a shout out. Thank you. We had a little bit of chaos about whether DCED should manage the waiver or whether OCDEL should manage the waiver, and there was a little period of confusion about that process. But we've clarified moving forward, all waivers related to supporting child services in counties that are red will be funneled through our Office of Child Development and Early Learning, and that's being managed by the Bureau of Certification. And when we grant waivers, we're maintaining a list of open facilities on the DHS website so that we have a consistent place to point families and give them information about who might be available to provide care in their communities. That list fluctuates daily, and it's really a function of the local child care, or in those instances, the part-day school age programs, decisions about what's impacting their community. And so as we talk about what the options are for COVID-19 now and moving forward, we just want to say that we recognize that there are a lot of factors that a program needs to take into consideration around their operations, how they're supporting their staff, how they're supporting their families, and what might be happening in their communities that they're making decisions on. So in regards to the waiver list, that's a list that fluctuates daily in the numbers of providers that continue to remain open or might make a decision to close. And we update that list to the best of our ability daily. A lot of the decisions around closure, at least in the child care space, when we sort of ask about it, are more about the fact that currently the demand isn't there for child care. And that may change as we move from red to yellow in many counties. But many providers that remained open, either families changed their mind and didn't want a formal care situation, or there just wasn't enough families coming into care to help a provider remain open in terms of their business model. And right now in this circumstance, while I would love to say we don't want to manage that list daily, that's a service that we're providing so that there's a marketing tool to know who's open and who might be accepting enrollments. that we share with our early learning resource centers, and we're also sharing it with legislators, with industry leaders. We've had quite a lot of interest in understanding more about the child care system and the part day opportunities from business leaders so that they can support their staff who are planning to come back to work. So we will continue to post the providers that are open for the foreseeable future on that DHS website, which is separate from Compass. Compass still displays every open licensed child care facility in the Commonwealth, whether they actually have their doors open right now or not. So the need for this DHS website is really important because it's clearly labeled that these are providers and part-day school-age programs that are operating during COVID-19. So that sort of brings us into early May that we began to start to think about what the information is for providers that are remaining open and how we can message and communicate with them and answer their questions, and work that we're doing to transition and move forward to providers that are thinking about reopening. So one of the pieces, and I think I'm just going to acknowledge that this is a source of frustration. So as much as that we can provide clarification in conversations that you might have in terms of follow-up conversation, is this idea about guidance coming out to the field. And what we've had significant internal conversations around is utilizing the Centers for Disease Control and Prevention, or that acronym is the CDC, as being the most trusted and reliable source of information that we have available to us. And so there's been a real hesitation to commit into Pennsylvania-specific documents what the information being posted at the CDC is, because it's updated and changed very frequently as they're learning more about this virus, that they're learning from other countries, and they're updating their recommendations. So what we're going to work at doing is tightening up our message about recommendations that we might be making for people to consider reopening, next steps that we want people to take as they think about reopening. But when we talk about guidance for remaining open, it's really going to be to specifically turn providers in the child care space back to the CDC guidance that's referenced, CDC guidance for child care that remain open. Now, I know that many of you on the call are not child care, and there's another portion of the web page that speaks to the K-12 system. There's significant overlap there that between the information for school districts and child cares that remain open, there's a high level of congruity and alignment. That recommendation about how you should be taking into consideration screening practices, grouping, social distancing, what that looks like for children in a space for care that's different than what might be out for businesses. That guidance is really solid for you to familiarize yourself, whatever your moniker is, whether you're a child care program serving school-age children, or whether you might be one of the part-day programs that's operating. So I would really encourage anybody that's interested in understanding that to look at that CDC guidance. And in order to sort of break that information down, because there's a lot of guidance on the CDC website, we're very specifically citing a link to that specific guidance to child cares that remain open. That's the title of a web page. And then we are also taking advantage of the fact that we have a senior health policy expert that's on staff at the Key, who has convened a group of pediatricians from Pennsylvania's American Academy of Pediatrics to advise us, as well as the department and the governor's office is receiving public health guidance from the Children's Hospital of Pennsylvania about supporting children in this space. So that's just one of the things that I would call out for folks to familiarize themselves with as you're thinking about making decisions. Amy Requa, our health consultant, is then taking the information that people find that they would like more clarification around and breaking down that CDC guidance into webinars. So Again, not quite 100% aligned between a part-day school-age program and a child care program. I really do think it might be worthwhile just to listen to that webinar for centers to hear Amy's review of what the CDC guidance is saying. And that might be beneficial for you to help think about what your planning is. Additionally, yesterday, Tanya Vasquez, who is the director for the Bureau of Child Care Certification, and I did a more administrative focused webinar that talked about what the process is for considerations moving from phased red counties and those 24 counties that are targeted to move to yellow at the end of the week. And we discussed on the child care space side some of those things that are recommended in the CDC, activities that we would advise in terms of what you should self-assess of your own staff and business practices and your comfort level reopening with some of these recommendations. One of the biggest pressure points that we hear back from folks is this idea of two things. One is a frequent stakeholder that usually bubbles up to the governor's office, this idea that how can we put children back in together in group settings when we don't know what the impacts of this disease is on children? And we actually have posted a slide in the presentation yesterday that the Department of Health provided to us, that their information that they're seeing about the impacts of COVID-19 on healthy young children, as well as some information from the CDC and from Harvard Medical School Journal, really seems to indicate that healthy children don't experience COVID-19 the same way that adults do. And certainly there's consideration for children that might have underlying medical concerns that the impact to them would be different. But for the most part, children don't experience this as severely, and they don't seem to be coming down with symptoms of the disease the same way that adults do when exposed. And this was reinforced on May 4th. Our Department of Health put in their daily press briefing some statistics about exposure and confirmed cases in Pennsylvania, that less than 3% of the confirmed cases in Pennsylvania were children under the age of 18. Similarly, one of the statistics that we were sharing is statewide through the waiver process, or for childcare or the part-day school-age programs that did operate during the closures, we only had 10 confirmed cases in that whole space during that time in childcare. And certainly, you know, 10 cases, we would prefer that number to be 0, but when you think about the number of children statewide that participated in a group care setting, that statistic of 10 really reinforced what we were hearing, because some of those cases were staff members that were identified. So that's one of the frequent stakeholder concerns that's elevated and sent back to our office. The other concern that comes back to us frequently is the issue around wearing masks. And Amy Requa will be doing sort of a targeted webinar that will end up being posted on the KEYS website as well about the recommendations from the CDC around masks. And it's worthwhile mentioning that because we are indicating that that's the guidance that we're following, masking of children above the age of 2 when it's developmentally appropriate, older children and adults in group spaces is highly recommended, to the point where it says when feasible, staff and older children should wear a mask, cloth mask. And so we get a lot of questions around this process, complaints, especially in the space for younger children, about wearing masks. And as long as that is the current recommendation from the CDC, that's what we're going to continue to promulgate as the guidance. And as I mentioned, we'll be putting out a webinar around some of the recommendations about how you manage masks in a childcare space. So those are the two primary issues that we're faced with in terms of how could we think about, or have you thought about, or this is dangerous, that we've responded to. So the next step moving forward is, many of you, I'm sure, are aware that the schools are not coming back into session for the remainder of their academic year. And so as we move into summer, this is something that we're really trying to consider what our options are and how we can best support families engage in some sort of structured activities or care if they need this as counties move into yellow. And I think that's probably what you all are interested in, is understanding what your options are. So certainly, if you are a school-age childcare provider and you're licensed, Tanya and her team have an existing emergency relocation process in place that if you're not able to access your public school building because of the decision to close, but you've identified other space, you can reach out to your certification rep and they will work with you to work through that emergency relocation process, which is already part of our certification processes. We're just recognizing that we're going to have to tap into that process much more heavily this year than what we have before. So that's one option. The other option that as a result of COVID-19, will be doing is we will not be adhering in 2019 and into the beginning of 20, the 90 days, the 90 consecutive day portion of the regulation around part day school age programs. So certainly we know some of those programs began operating at the beginning, at the beginning of April. And for those programs, they might be planning to continue to try to operate straight through the summer. Other folks are thinking about trying to open and start now. And so we recognize that that is not realistic to look at the 90 days in some cases. So we wanted to share that with you now, that particular segment of the regulation will not be enforced in this summer of 20. So as you're thinking about how you may restart program activities, that might assist you in your planning. And I know that there's just a real interest in trying to get guidance out and supportive opportunities for folks that are trying to figure out how they fill their niche of supporting school-age kids during this time. So I know that many of the team that regularly work with me have suggestions that they might want me to speak about. So I'm going to stop a minute and from Tanya or Karen or Colin, those of you that have heard this conversation in different audiences before, are there pieces of what you think this group might want to know that I might have skipped over?
No, I think you covered what you've been covering. There are some questions coming in the chat.
So before we jump into questions, can I just get one more thing out that came to mind that's probably really meaningful to this group? So the K-12 systems are really looking at how they support continuity of education for their students. That even though face-to-face opportunities have halted for the remainder of their academic year, they're still trying to engage and support school-age children to the extent possible that they can. So one of the questions that we've received just in the childcare space, and part-day school-age programs might be thinking about this as well, is what's our obligation to utilize that continuity of education plan that the K-12 system put in place. And this is one where I think there's not any sort of overlap or authority that requires us to support continuity of education, but I think many of you have great relationships with your local school districts, and if you're open or you're thinking about reopening, I would suggest to the extent that it's feasible, and certainly it may not be, but the extent that it's feasible, how might that work fit into your plans for activity for what's happening with kids when they come back into your care spaces, whether they're licensed or unlicensed. So this is also we didn't talk about it, but I'm really interested in the questions that we get to from you guys, and anything that might be into the chat box after we're done with our remarks. Being able to take that back, because as I mentioned, there's a group that's broader than Octal that's really interested in seeing what these opportunities are to be responsive and supportive. So your questions, while we might not be able to answer them, are really going to be helpful for us having those conversations as we go along. So Karen, I'm going to see what you want to toss out.
Okay, so I'm trying to group some of these questions. There seems to be general questions around children as carriers and what programs should do if there is an exposure at their site.
So right now, the children as carriers is a valid point, and so that's part of the reason why the CDC is recommending that staff and children wear masks. Again, I'm going to defer to this guidance, even though some of you are not licensed entities. It's solid foundational guidance for how you should operate throughout the day. And there's a frequent recommendation about sanitizing and cleaning surfaces more frequently than what you might normally do so. High-touch surfaces, disinfecting and cleaning, as well as frequent hand washing and working with children to really pay attention to, you know, if they're sneezing and coughing, or intentionally working with them to avoid touching their faces, and with younger children, oversharing toys. But children coming into spaces, the CDC recommends screening, and they've actually provided 3 different models that you can pre-screen children at drop-off. And I don't want to get into those, but it's an idea about how you can communicate with families about children's arrival to take a good health pulse check on them and their family coming into a care setting. Then once they're in care, the recommendations about social grouping in these child care spaces are, if possible, to keep group sizes smaller. If not, to maintain the organization of children and staff in consistent groups that don't frequently change rooms. And again, to the extent possible in the model that you're operating, so that your teaching team or your care team and a group of however many children are together throughout the day. And that prevents cross-exposure in rooms. When children have been identified as confirmed cases of COVID, and again, I don't have the slides in front of me from Amy's presentation, it's not enough to be necessarily in a space with somebody who's confirmed positive, but there's a little bit of a definition in the slides that she uses that talked about sort of the duration of exposure, and what that recommendation is to contact the Department of Health and inform, if you're a regulated provider, inform Octal so that we're aware of that. But there's also guidance that's out there that talks about if staff or a child has a confirmed case, the ability for them to go home and quarantine until they're healthy, cleaning and sanitizing, and consultation with the Department of Health around whether or not the space should remain open with deep cleaning or whether it should close.
Okay, Trace, we have a number of questions. They're similar, but they're pretty much around what conversations are happening with PDE about access to their buildings, about finding alternate space, and what kinds of DHS regs would be applicable to people.
So if you are a licensed childcare that's displaced, well, so let me deal with license first and then the rest of them. So PDE knows now and has an understanding of how many school-age programs were licensed in school buildings on the state level. And so again, as I said, these conversations are happening. I think that there's some that are unresolved, but there's a deepening knowledge about the school age population in general that's occurring. So when you move into an emergency relocation circumstance where you've identified another space that's appropriate for your program in the community, certification will work through that process. And broadly, the goal is that all regulations would be applicable if you're a licensed child care provider. We have made recommendations that we are starting to understand that we can message more about that are going to be suspended now because of the impacts of COVID-19. But there are some that are non-negotiable, and they're around the staff and the clearance and staff health assessments. And that's embedded in our webinar that we did yesterday. So Tanya, I don't know if there's like another high level thing about the emergency relocation. I know you're listening out there. If there's something about that process that you'd like to talk about before I move on.
Yes, this is Tanya Vasquez. I did just want to mention again to contact the Oakdale Regional Certification Office that you generally work with, and they can review the protocol for an emergency relocation. But I do want to also mention, because I think this is an important point, in looking at a potential location, you're still going to have a certificate of occupancy to use that particular building. So when you're trying to determine where you can possibly operate your program, please make sure that the building has a certificate of occupancy, and it really should be a certificate that indicates it's approved for education, or that it has been inspected and it is at least approved for use as a child care. So for those of you that might be looking at like a church or maybe a closed business, that is going to be an important aspect of this, because we'll allow you to use the space, but you will have to provide the certificate of occupancy that does inform that it has been inspected and it's approved for use for childcare.
So Tanya, while you're still on the call, there were some more specific questions around if you could talk at all a little bit more about the suspension of potential suspension of any regulations, and then specifically around will there be buffers for being able to get health assessments either from children or staff?
So yes, I can talk about the suspension of regulations. The suspensions would involve child health and child records. It does not apply to staff health. So if you are in a position where you're going to employ new staff, there would still be an expectation that that individual has received a health assessment within the previous 12 months and has a tuberculosis screening. And that would still be required, as well as the updated health assessments that are required every 24 months. So we were not suspending staff health assessments, but there will be the suspension of a newly enrolled child who typically, for instance, needs to report on the file 60 days. We're allowing some additional time to get that for a child. In addition to the suspension, we're also looking at the updates of child records to allow more time for that, the child service reports to allow more time for that. But for the staff staff files, clearances are still required. The NSOR, the child abuse, and the Pennsylvania State Police clearance are still required, and they are being issued and processed. There is a House bill that I can also reference, House Bill 360, that I believe will be signed, if not today, in the near future. And that specifically, that is legislation only regarding the FBI clearance, because we know that during COVID-19 that over half of those FBI fingerprinting locations did close, and we understand that there has been difficulty in obtaining the FBI clearance. So there will be some legislation allowing for a provisional hire of an individual who does not have an FBI clearance, but that individual will have to be supervised at all times until he or she obtains the FBI clearance.
Okay, so there are a number of questions related to masks and other health kinds of questions. And I think, Trace, if it's okay with you, I think we should just really highly recommend that folks view those webinars. And I did put the link for the PA Keys site where you can find those in the chat box. So because we have 25 more minutes, I want to just make sure that we have enough time to get to the other questions. And I really think, I'm thinking Amy, she's the content area expert on this. So we want to really refer you, if you have health related questions, to those webinars. People are asking for more clarification around whether or not they will be allowed to use school district buildings, either in the interim before summer starts, or then also during the summer. If you could talk at all about that.
So I'm going to have to take that back to one PDE. So there's the state level recommendations or not recommendations, directive that came out from Secretary Rivera. And then there will be the local school district considerations. So I cannot answer that right now, but we can definitely highlight that as a need for clarification and what those parameters from the state's perspective may be. And I'll take that back as a follow-up. And then however you all became aware of this call, if Betsy has a listserv or I'm not sure how the awareness was generated, but we can follow up and make sure that that gets out when we have an answer or guidance.
There's also questions around, oh wait, I just lost it. I'm so sorry. Activities for summer camps. If you can talk at all about, people are asking, are they still going to be able to take trips and go to the pool and those kinds of things?
So this is one that is under consideration right now as we speak. When we started to have the discussion about moving into the yellow phase, there was really a focus on childcare and sort of the traditional thinking about childcare and parents dropping their children off at a space. So when we raised the issue about what normally happens in summer and camps, and a lot of times camps are what is publicly branded is technically really a part-day school age program. And so we've asked the Department of Health to make their recommendations and guidance about what they will see happening, not happening, and we don't have that yet. So it is something that I just want to confirm is being actively looked at, and people do understand that because school is out, the priority is sooner rather than later, because really those activities might be scheduled, or people might be thinking about those activities here for May or very early in June, where they might not have started until later in June before.
And then Trace, there's also questions about, they're very similar, and I think it's going to be the similar answer, but just to clarify, if they're running the camp from their childcare, their certified childcare site, if there are any differences to that.
So in my recollection, when my children were little, my childcare had their regulated care, and then they marketed something that was separate for families in the summer that was school age focused, that was considered camp. And they functioned very, very differently. So, depending on what the recommendations or the directives are from the Department of Health about what are those outside external facing activities, if it's really about a clarification of like going to the pool or going to parks, those types of things we're going to need to defer to the Department of Health for. So I think there's some more clarification around that. As far as developing a program for school agers to come back in, if you need to expand to serve school agers right now, you have the purview to do that. But some of those extra things that you might have done that were specific to school age kiddos, that's where I don't necessarily have the guidance to give you right now. There's
quite a number of requests for somebody to clarify the statements around impacts to ratios and capacity. I'm assuming basically, are there going to be restrictions, increases in ratios and restrictions on capacity?
Sure. So this one I can answer. So when we went through the phased-in approach, one of the original statements that was included for childcare was that it would follow the business and worker safety order that Secretary Levine issued. And we've since clarified that that specific order is not applicable to childcare. So while CDC recommends, if possible, you have smaller group sizes to mitigate the spread of COVID-19, we're not changing any of our ratio recommendations from a licensing perspective. I would like to clarify that there is also some confusion in that the legislature developed a plan for reopening Pennsylvania that included childcare in the businesses that would have a significant reduction in participants. I think it fell in a category where they were suggesting 20%. And believe me, I heard a lot about that from childcare, thinking that that was issued by the administration. That is not the administration's guidance for operating. And right now we are suggesting that you do some thoughtful planning around whether or not you can offer some smaller group sizes, but we are not changing our current ratios or limiting the number of children that can come into a facility. What we do say, however, is you should select one of those 3 screening methods and implement one of those screening methods to make sure that you're taking a look at children's health and staff health and any adult visitors' health as they're coming into your sites.
There's some questions around childcare works payments, and if you can get into how that's going to work.
Sure. So right now we have issued a current policy, and the policy is extending what was issued for March, and it indicates that right now child care works payments are made on enrollment versus attendance. So if you're open or you're thinking about reopening for the remainder of the month of May, those payments will continue based on enrollment in your program. Each month, as we understand more and more the implications of what's happening and what changes are occurring, we come together and talk about what the recommendations should be for the following month. And so we will be convening next week with the intent of issuing an update to talk about what our recommendations are for June, so that we can get that out to the field before the end of May. So if there's any changes or any clarifications to that policy, it would be reissued for June moving forward. And recognizing too, and I just want folks, I'm not sure sort of the breadth of where you all are located in terms of your geography, is in your thinking and planning, certainly 24 counties moving from red to yellow is very positive movement. But based on what happens as a result of that movement, it could be conceivable that communities move from yellow back to red, or if the red counties aren't making any kind of marginal increases or decreases in their number of cases and the statistics that the administration's looking at, they may not move out of red anytime soon. This is really very data driven. And so I just want people to be aware of the timing around this. There shouldn't be an assumption that, and this goes back to what I understand the legislative plan was, they were proposing that there would be 2-week cycles where counties would reopen with 2 weeks staggered entry points. That is not the administration's plan. The administration's plan is really looking at the data that's available about cases and the impact and making that informed decision to reopen. And then again, as I said, if there's resurgences of active cases, that decision could go the other way.
So Trace, there are a number of, they're not so much questions, they're statements, but I think they kind of require some comments. Things like my capacity is 120, so I can have 120 kids in the cafeteria. We can have full capacity, but businesses have to be, at reduced. Can you talk at all about the difference between what the regs are, saying versus best practice, that kind of stuff.
Right. So with a business and the capacity. So first of all, if you are looking at this and you don't feel that that's appropriate, if 120 in a cafeteria is something that's of concern to you, and you don't have the ability to reduce your groupings, and I would challenge you in 120 in a cafeteria if you really have the ability to manage small group sizes. The difference is that all of those children that are participating in your program have had a daily screening assessment about their health that day. And the way that you need to be thinking about your programs in reference to the guidance that's available is, how am I keeping those groups of children and staff separate from each other? How is that structured, that 120 in a cafeteria, how is that structured over an 8 or a 10-hour day for a summer program, so to speak? So the difference, I think, is the frequent sanitizing of surfaces, the health screening, the masking of children and staff, the conversations with families, that in a business that's open to the public, such as a grocery store, you don't have the ability to control and manage the in and out of people and the fluctuations that they individually bring into that setting. Even though we're not restricting capacity, there are still some other things that I think responsibly you need to review and think about how this is being implemented based on the recommendations of the CDC, to be able to sort of be responsive to those recommendations.
So there's a question, somebody is asking if you can define supervision of conditional employees.
Tanya?
Yes, did I put myself back on mute? Sorry.
You're good. You're good.
Okay.
We can hear you.
All right. Supervision means they must be supervised at all times by a permanent employee. A permanent employee is an individual who has all of their completed clearances on file.
Okay. They're asking if, is there any kind of large scale surveying of parents to find out who needs care versus some people are talking about surveying parents in, within their programs?
So right now we haven't had that discussion about surveying families. So I mean, I think it's a valid point, but we haven't gotten there in our planning discussions yet. That is one of the recommendations that I'd made. If you have contact for families that are traditionally enrolling, part of the movement from red to yellow was the continued recommendation that if families can telework, that they continue to telework. If you are a child care provider who's remained open and you happen to be on this call because you expand for school age or you have other locations that are school age, one of the pieces of feedback I mentioned early on is providers closed in the waiver process because the demand wasn't there, even though people were working. So there's a couple reasons that the ELRCs kind of ask people what they thought the reason for that was, or what families were doing. So, K-12 is not in session right now. So while there's an increased demand for children under 13, there's also a broader resource of high school kids that might normally have been part of the babysitting pool. Many businesses didn't move to telework. They temporarily closed, and during the stay-at-home orders, people's work needs changed. So there's a broader availability of other family members that might be taking care of children. There are families that are in a telework situation and they are anxious about returning their children to care, either for their children's health and well-being or the recognition about children as being transmitters of disease, and a situation where that would have a more negative impact to the adults in the family being vulnerable than the actual children being vulnerable. So there are families that are figuring out other ways to manage their needs because of the circumstance. And of course, then many of the higher ed institutions sort of add into the labor pool as well, that there are college kids that are home that might also be filling the role of caretaker for younger children at this time that aren't usually available. So, I mean, that idea about demand and what will the demand be, we haven't done that assessment and we don't know yet. So for our purposes, the reopening of the 24 counties, we will really be trying to understand and get feedback from stakeholders in that process to, one, see how we can continue to support them, but what are they finding out and what are they experiencing and what are the recommendations that they're having, because we think that on-the-ground experience is going to be really helpful to us, and we will deeply appreciate hearing that feedback from folks.
Okay, so we're still getting a fair amount of questions around, I think, what I would call health-related questions, things about the frequency and how to sanitize and screen and do temperatures. And again, we're going to refer people to the CDC guidance, and then Amy Requa's, her webinars. We will make sure, I put the general PA Keys coronavirus link in the chat box. I know there's a lot of resources on there, so we will make sure that Betsy has the direct links to those webinars that she can send out to everybody. But I really recommend that folks look at those, as well as questions about what to do if there's an outbreak at your center. And I think, you know, at that point you want to refer to the, you know, the Department of Health as your best source for that information. There's some questions around if there are going to be any places to go for suggestions for alternate activities if things like pools aren't open to take summer camp kids to.
So that's actually a great, I know that we put together some resources and made them available for families that were sheltering at home and might not normally be supporting their children all the time. So that idea about what are alternative strategies for the summer, I think, is a good one. So again, Betsy might have thought about it, or Karen, you might have thought about it, but I had not thought about it yet. So if we could maybe work together to see what those appropriate suggestions are. One of the things that we are being very sensitive and intentional to is we really want to vet things with the Department of Health. Secretary Levine and her team are the health experts in this situation. And while we have access to the pediatricians from the AAP and the CHOP policy lab, our recommendations also go through the scrutiny of the Department of Health team as well. And so I think just recognizing summertime and the activities that are typically available to support young children and what those possibilities are, and what's still considered sanctioned, so to speak, I think would be important. So I will definitely take that back. And then I think people, if you have thoughts, we can try to collect those and sort of make that technical assistance support or resource support.
So there's questions about if you're currently operating on a waiver, are you supposed to be refusing care to families that are not essential employees?
So I want to go back to that statement I started out at the very beginning of this. Right now, for counties that are red, the governor has a life-sustaining business list that's available online. And in addition to that, there are businesses who were granted waivers because they made the case that they were life-sustaining. So I want to dispel right now the focus that many people got very lasered in on essential employees being medical personnel and first responders. In Pennsylvania, if you were a parent of a child who had to work during red phase because of your position in federal, state, local government, law enforcement, the medical field, you're a grocer, you're agriculture, you're sanitation, you're transportation, the list is very, very broad. Our opinion is if you have to work, we want to support child care providers that were willing, or part-day providers that were willing to remain open to support you while you had to go to work. So in other states, and I know that many people are linked into resources and technical assistance, every state has approached what an essential employee is differently. And our position has been, if you're required to work at this time to make the basic services that we all depend on available, you are essential. And if a child care provider is willing to remain in operation during this time, then we want to support them and allow them to get kids in care that need to be in care.
So there's a question about any considerations to HIPAA if you're taking children's temperatures and recording them.
I have not been posed with that question before.
Sorry to throw that at you, but I found
again, and I just want you all to know, I don't have, and we as a team don't have all the answers, but that's a great question. So let me add that to the list of things that we need to follow up on.
Yeah.
I think that I just want to say my gut reaction is HIPAA is about sharing health information, and it's about the sharing of it beyond the purpose that you as an organization are using it for with somebody else. So I do know that Tanya has received from the child care providers a lot of questions about updating policies and what the change may be based on the screening drop-off procedure they elected to use, and sharing some of the things that might be changing as a result of their operations with families. So I would certainly say that you should communicate the fact that this is a criteria that you're implementing for participation with families so they're aware of it. And I think families would appreciate the attention to children's health, and really it's about protection for their family and your staff as well at this time. So we will clarify about the HIPAA piece, but my gut reaction is it's not a HIPAA issue.
And then Trace, there's a
I could be wrong. I've been wrong about other things before.
There's a couple questions that I'm going to throw out a quick answer to, and if you want to add, please do. But there was a question about if there's any liability if somebody becomes infected at their site, and our answer has typically been, that's a conversation you need to have with your lawyer. And then if staff do not want to, if staff have concerns about working, can you make them work? And I think those are also questions that are probably more better answered by folks at Labor and Industry, unless you want to add anything, Trace.
Sorry, I was having an incoming call and I couldn't get off mute. So the thing I would just want people to be aware of, if you're not, that COVID-19 on the federal level has, and I am not expert on this, but I just know enough to make you aware of it, had made available additional leave for families as a result of COVID impacts. And they're not all related to a person or their family member being sick. There are some other implications there that, again, I would suggest whoever is responsible for your HR services to connect with around some of the expanded and enhanced leave for families that are facing issues related to COVID-19. And your comment, Karen, about the liability, it's your attorney and in many cases who your insurer is. I would just throw your insurance company in there as well.
So we're running down. We only have a couple more minutes left, but there is a question about when they can expect certification reps to be visiting sites in the yellow areas again.
So this is Tanya, and Tracy can certainly jump in. At this time, all annual renewal inspections have been suspended. There is currently discussion regarding how and when those inspections will begin, but there is still a suspension to those types of inspections. Certification is investigating any complaint allegations that are received. Tracy, I don't know if you want to say anything more about the renewal inspections.
No, so I think that you know, we're in, and I think you've probably heard this before, but we're in an unprecedented time in our operations. And so I know that people ask these questions because they're concerned about what they might be potentially trying to manage and restarting and having staff come in and figuring out how to implement best practices and new guidelines. So we understand that anxiety about, and I also want to be in compliance with my state certificate. So while we consider what that timing and schedule may be, when we do implement it, we will communicate out to you well in advance. It won't be like, hi, we're implementing it and we're here tomorrow. We'll implement it and let you know that we're returning to that regular schedule. As Tanya mentioned, we are doing complaint investigations, and we would expect that everybody's doing the best of their ability to remain compliant with the regulations, even though we're not out on site inspecting.
I think that's pretty much it. And we're down to just one more minute. And again, we're still getting some questions around health related things, cleaning, those kinds of things. I again encourage everybody to, when Betsy's able to, can get that information out to you to view those webinars and to make yourself really familiar with the CDC guidance. There's a lot of questions.
Karen, let me just be more direct and blunt than that. If you're one of the licensed childcare out there and you're thinking about reopening, you must look at that CDC guidance for centers that remain open. That is a, you must do it. You got to be familiar with it. That is our recommendation. You got to do that. For the rest of you that offer sort of school-age part-day programs, it is a strong, strong advisement. And in terms of us sending out and being responsive about health information, we are really using Amy Requa and the webinars that she is developing to be responsive to that need. So as we have future opportunities to come together, we are not going to get into answering those questions in the time that we have together. And if we're not answering them on the webinars, Amy is more than willing to come up with focused content-specific webinars to address any unmet need that you think that we have.
Yeah, I did put in the chat the email address that folks can put direct questions in, like things that they want to see covered in the webinars. There is a question, Trace, right before we get going, about being required to hold if they're required to hold children's spots if parents don't want to return because of COVID. So
our position that is the provider agreement between a regulated child care provider and a parent is something that is not within the authority of the department. And so the flip side of this has been around the closures. We've received a lot of complaints from parents in those circumstances where providers felt that they needed to continue to charge them for their tuition payment. We're really entering a new phase of normal. So I would say to you, what are the constraints or what are the directions in your provider agreements that you've written into when parents elect not to return to care, and what your guidance is that you've issued in that policy or in your handbooks. But if a family is indicating that they're not returning or that their work's not operating, I would suggest to you that you handle that in the same manner and format that you do in normal circumstances. That seems to be one of the places where business practices could have some continuity. Okay, and with that, I know that we're still getting some questions. We are at 1 o'clock. We've recorded this so folks will be able to go back and listen to it again. We're going to save the chat and make sure that if we've not thoroughly answered questions, that we get those questions answered, and we will make sure Betsy has all of that information and can get it out to you folks. I'm going to put my name and my email address and phone number in the chat also, and you can also, talk to me or request some information or any, questions for me, and I can point you in the right direction. Did you have anything else you wanted to say before we close up, Trace? Sure. So I did think Betsy was going to leave the chat open for a few more minutes. So if people hadn't had the opportunity to put a question in after we get off the call, that like I think for 10 minutes or so, the chat will still be open. And again, I just want to sort of wrap up things with, I mentioned this before, we are dealing with a circumstance that we've never dealt with before. And so we are continually looking for these feedback loops and being challenged with things that we hadn't problem solved yet or had the opportunity to think about. And one, we appreciate it. And while I will be honest, we don't always have the answers, then we know our next step is to figure out what those responses can be. But it also means that as we get more information from stakeholders, from the governor's team, from the CDC, from Secretary Levine's team at the Department of Health, we have found that we need to change policy or positions about how we're operating in our new world. And so I just want to recognize that. And in some cases, it's a really good thing because we are able to be more responsive and address activities that we hadn't previously thought about. But it also means that the communication that we're trying to put out comes very, very frequently. So if you are part of the certification listserv, or if you're part of the Pennsylvania Early Education News listserv, we've been trying to make a lot of our communications or general updates that we're doing outside of newsletters available directly through our listservs. But then we're also pointing people back to the places where we do have resources posted. So I know that that's a stressor for people to get frequent communications and a little bit of burnout, but it's just a function of how quickly information is evolving right now. So I would just close with, a thank you again to Betsy and Karen for suggesting this. I know all of you are really thinking about how you're supporting children and families and what makes sense as we move through red to yellow, and what this means for you individually. So we want to try to be as responsive as possible, and just thank you for what you and your teams are considering doing or what you're already doing around supporting Pennsylvania's kids. And I just appreciate everything you're doing, and we'll try to get back to you with updates as quickly as we can.
Yes, and I just want to say thank you very much, Tracy, for being with us today. And I think that, I hope that, and I believe that there'll be more opportunity for all of us to get together as things start to reopen and more issues surface for people. Tracy and Karen have been there for the school age community, and we greatly appreciate them getting on today and supporting some different things that happen in the school age sector that needed addressed. So thank you so much for doing that.
Thanks, everybody. We'll leave the chat open for a bit.
Goodbye, everybody. Best wishes.